Hi everyone. In this video we'll be going over the use of eyelid retractors in the ophthalmology clinic and indications of when to use them both in clinic and in the operating room. Eyelid retractors are commonly used when there needs to be an optimal view of the globe. Of course, the view of the globe can be impeded in cases where there's severe eyelid swelling. This is commonly seen in periorbital and orbital cellulitis and also in trauma. Lid retractors are used as well in ocular surgery, again to have an optimal view of the globe. In the next slide, I will go over my own personal technique of how to put in a lid retractor in the clinic. There is many different variations in how to use an eyelid retractor, and of course there's many different types of eyelid retractors out there. This is just one technique, but as I mentioned, there's many different ways of doing this. Before I begin on the steps, I would like to mention that in terms of positioning, I would like the patient usually to tilt their head back, as this gives me a better view of the eye. Starting in step number 1, it's important that you have all your equipment. This includes the eyelid retractor, as well as an anesthetic eye drop. Eyelid retraction involves putting in a foreign object around the lids, and so it's very important to use an anesthetic eye drop to numb the eye, as depicted in step number 2. In step number 3, 4, and 5, the key is to avoid touching the cornea. What I personally like to do is I like to put in the retractor in the inferior lid first to optimize, or I should say to reduce the chance of corneal involvement. I will have the patient look up, and then I will proceed to put in the speculum in the inferior lid. I will then pull up slightly on the lower lid and then have the patient look down. That way now I have a safe entry to put the upper portion of the speculum on the upper lid. Once this is secure in place, I tell the patient to return back into neutral position, and now the speculum is 100% in place, and in comparison to step number 2, we now have a full view of the globe. I hope you find this video to be useful. If you have any questions or comments, leave them in the comment section below. Thank you.